Hi, my name is Jahida. I'm going to be doing the Skull series trigger. The projections that I'm going to be doing is the SMV. That technique is going to be at 80 at about 6. I'm also going to be doing the AP axial, which is known as the town method. And my technique for that is going to be 80 at about 16. And then I'm going to do my PA axial, which is a Caldwell. My technique for that is going to be 80 at 12. And then I will be doing my lateral, which is my technique would be 80 at 6. So I'm going to make sure that I am detented. So I'm going to be detented to 40 inches and then make sure that I'm aligned. Okay, so I'm going to go ahead and call my patient back. Anne-Marie Montalvo. Hi, my name is Jahida. I'm from radiology department, so I'm going to be taking a couple of x-rays of your skull. Can I get your full name and date of birth?
Anne-Marie Montalvo.
Okay. Is there any chance of pregnancy?
No.
Do you have any hairpins or anything in your hair or earrings?
No.
Okay. Do you wear dentures?
No.
Okay. So I'm going to have you be sitting on the chair here.
Okay.
And then I'm going to go ahead and shield my patient. The technique that I'm going to be doing is the SMV. I'm using a DR system, so I don't have to be switching out the plates. And I'm going to be collimated to a 10 by 12, and it's going to be lengthwise. My central ray for this image is going to be between the angles of the mandible, and it's going to pass three-fourths A anterior to the EMA. And my mid-sagittal plane is going to be perpendicular to the IR, and my IOML is going to be parallel to the IR. Okay, so scoot you forward a little bit, and then just tilt your head back. Okay, so about right there, and then I'm going to put my right marker indicating that it's my patient's right side. Okay, so then I'm going to do is going to be the AP axial. My central ray is going to enter 2 inches above the glabella, and it's going to pass through the level of the EMA. My patient's mid-sagittal plane is going to be in the middle of the IR. The OML is going to be perpendicular to the IR, and the central ray is going to be directed through the foramen magnum at a caudate angle of 30 degrees, and it's going to be at the OML. So I'm going to go ahead and put my angle 30 degrees. I'm going to flex my patient's head forward. Now I'm going to move my butt down. still, ma'am, please. And then again, I'm using my right marker, indicating that it's my patient's right side. Okay. So X-ray. This projection that I'm going to do is going to be the PA axial. I'm still going to be collimated to a 10 by 12. My central ray is going to exit the nasion, and I'm going to have a 15-degree cotted angle. And the OML and the mid-sagittal plane are going to be perpendicular to the IR. So I'm going to have my patient stand up. And then I'm going to have you sitting this time facing the board. And then I'm going to move the and for this one I am going to be my IR is going to be a 10 by 12 and it's going to be lengthwise for this one, so I'm going to have a 15-degree angle. And then if you can just scoot in a little bit. And then I'm going to tilt my patient's head forward. There. So again, just check to make sure that it's exiting the nasion, and then I'm going to have my left marker indicating the patient's left side. Okay, so then I'm going to go ahead and the next projection that I'm going to be doing is going to be my lateral projection. I'm going to be collimated to a 10 by 12, and I'm going to be crosswise. I'm still going to be at 40 inches. My central ray is going to be parallel, and it's going to enter 2 inches superior to the EMA. My mid-sagittal plane is going to be parallel to the plane of the IR. The interpupillary line is going to be perpendicular to the IR, and the IOML is also going to be perpendicular to the front edge of the IR. So for this one, there is no angle, so I'm going to take the angle off. And then I am going to put my patient in a RAO. So if you can go ahead and just look at me. So I'm going to be 2 inches above the EMA. Bring the bucket down, and up. So I'm going to have my, I'm going to put my right marker because it's the side that is closest to the IR. X-ray. use my trigger for the skull series.
So now that we finished our projections, we're going to go ahead and evaluate the images. The first image that we're going to evaluate is the SMB. And some of the evaluation criteria is that you want the entire cranium without tilt, and this is demonstrated by equal distance from the lateral borders of the skull to the mandibular condyles on both sides. You want the IOML to be parallel to the IR, and this is demonstrated by the mental protuberance superimposed over anterior frontal bone and the mandibular condyles anterior to the petrous. Some of the structures that you're going to see on this image are going to be the maxillary sinuses, which are here, and here. And then you're going to want to see the ethmoid and the sphenoid sinus, here and here. You're going to want to see the foramen spinosum, which is about here. And then you're also going to want to see the dens, which is here. The next image that we're going to evaluate is going to be the AP axial projection, which is the Town method. And in this image, the evaluation criteria is going to be the entire cranium without rotation or tilt. And this is going to be demonstrated by equal distance from the lateral borders of the skull to the lateral margins of the foramen magnum on both sides. Symmetric petrous pyramids, and you want the mid-sagittal plane of the cranium aligned with the long axis of the collimated field. You're going to have the dorsum stelli and posterior clinoid process visible within the foramen magnum. And then some of the structures that you're going to see for this image are going to be the parietal bone, which is here, the occipital bone, which is here. You want to see the foramen magnum here. You're going to have the petrous ridges here and here. You're going to have the posterior clinoid process, which is within the foramen magnum. And you're also going to have the dorsum stelli, which is also in the foramen magnum. The next image is going to be the PA axial Caldwell image. And for this image, the criteria is going to be equal distance from the lateral borders of the skull to the lateral borders of the orbits on both sides. You want symmetric petrous ridges, mid-sagittal plane of the cranium aligned with the long axis of the collimated field. And for this projection, it's going to demonstrate the petrous pyramids lying in the lower third of the orbit, which is here. Some of the structures that you're going to see is going to be the frontal sinus. You're going to see the crista galli here. You're going to see the superior orbital margin, which is here and here. And you're going to see the superior orbital fissure, which is in here. You're going to have the ethmoid sinus here. The petrous ridges, which are again lying in the lower 1/3. And the inferior orbital margins, which are here. The final image that we're going to be evaluating is going to be the lateral. And the evaluation criteria for the lateral is going to be the entire cranium without rotation or tilt. And this is demonstrated by the superimposed orbital roofs and the greater wings of the sphenoid, superimposed mastoid region and EAM, superimposed TMJs, and the stella turcica in profile. No overlap of the cervical spine by the mandible. Some of the structures that you're going to see are going to be the supraorbital margin, which is here. You're going to have the stella turcica here, external acoustic meatus, which is here, and then you're going to have the TMJ, which is here, and the petrous portion of the temporal bone, which is here.